Hi, I'm Gavin and this is my demonstration video for the app VitalLink. My app monitors the vital signs of veterans and PTSD patients through connected hardware, instantly alerting nurses to complications while providing personalized guidance and emotional relief for those who use the app outside of a hospital. It is designed for veterans and individuals living with PTSD, as well as the nurses and healthcare providers who care for them. The app was built in VS Code using Flutter and the Dart programming language, and it connects to a Raspberry Pi chip that runs Python to process data from pulse sensors and accelerometers. The app is also connected to a Firebase database. I will now be demonstrating the app itself. And then at the bottom of the login screen, there's of course a place where people can make their account and choose three different types of accounts, which is the nurse, the patient, and the individual. The individual and the patient are exactly the same, except for that the individual is not connected to the nurses and cannot be seen by them. First, I will be demonstrating what a patient and individual account looks like. The home page of the patient includes mostly their vitals, including their heart rate, which is shown in a graph that shows heart rate over the last 15 seconds, and a list for easy reviewing as well. The history screen shows previously complications that the patient may have had, which, if you go into, shows AI-generated activities that the AI thinks it's helpful for them to recover, such as doing meditation or seeking professional aid. One of the biggest parts of the patient side of the app is a chatbot where they can ask for advice and just talk to you for comfort. The chatbot extends into the tip screen where the tips that the chatbot seems to say the most will be saved here for quick viewing, along with chats that the patient has saved where they can review and quickly navigate to places that they want to look over. In the settings screen for the patient, they can change their name and toggle the theme from light to dark. In the nurse side, the home page simply shows a list of all of the patients added to the nurse's account. As you can see, the red ones are the ones suffering from complications, while patients who are perfectly fine are shown as gray. The other screen for the nurse includes a list where they can search for names and add them to their list. As you can see, the patient we just added shows up on the home screen now. The settings screen for the nurse is simply toggling things from light to dark. So the hardware that I used includes a Raspberry Pi chip connected to an accelerometer and a pulse sensor. The pulse sensor takes the heartbeat of a patient from their thumb, and the accelerometer measures sudden movements in the wrist. The data from these two inputs goes into the Raspberry Pi, which then goes to a database connected to the app. Thank you so much for taking the time and listening to my demonstration.